and welcome to Sex and Stuff. Today we're talking about bacterial STDs, bacterial sexually transmitted diseases. So let's talk a little bit about bacterial STDs. Now these STDs are cured by antibiotics. So think about what happens if you had an ear infection or a sinus infection, you take antibiotics. Same thing happens when you get infected with chlamydia, gonorrhea, or syphilis, you take antibiotics. But you have to remember that any type of bacterial STD, whether it's chlamydia, gonorrhea, or syphilis, the doctor is going to prescribe you medicine. You have to wait 7 to 10 days after you take the medicine to have sex with your partner. And you also want to do repeat testing in 3 months to make sure everything is good, okay? Now you can get these STDs any type of sex you engage in, whether it's oral, anal, or vaginal, okay? You come in contact with someone's vaginal fluid or semen, through any type of sex, that's how we get these STDs. So now we're going to talk a little bit about them each individually, okay? We're going to talk about their signs and symptoms, how we treat them, and how we test for them, and any long-term health issues if we don't get tested or treated. Now you can see that they're little STDs, okay? You might wonder what that means. Now think about chlamydia. Chlamydia was under a microscope, and we blew it up a million times. This is what chlamydia would look like. So let's start with chlamydia, okay? With chlamydia, most men and women don't have any signs or symptoms. However, if we do have signs or symptoms, men, you might have an unusual white discharge from your penis. It's not the same as pre-ejaculation. You may have burning or pain when you urinate. You may urinate more frequently. You might have swollen or tender testicles. Women, you might have an unusual discharge from your vagina. You might have burning or pain when you urinate. You might urinate more frequently, and you might have a stomach ache, kind of cramps associated with wanting to throw up, okay? Long-term health effects if we do not get tested or treated for chlamydia. Men and women, it can cause you to have problems having children. It can cause pelvic inflammatory disease in women, which can be deadly. Women can pass it to their babies. Babies can be born with eye infection or pneumonia, okay? We can treat chlamydia with an antibiotic pill. Again, you've got to follow all the directions the doctor prescribes you and tells you how to take it, okay? We test for chlamydia through a urine test, okay? However, if you are having other types of sex, whether it's oral or anal, talk to your doctor so they can do different types of tests, such as swabs, so they can swab your throat or your anus to make sure you don't have chlamydia, because a urine test isn't going to cover that, okay? You also, if you're having signs or symptoms, we can also swab that as well, okay? So that's all for chlamydia. Next, we have gonorrhea, okay? So gonorrhea, again, with most men and women, they're not going to have any types of signs or symptoms, okay? Now, with gonorrhea, okay, some of the signs or symptoms might be men. You might have a yellow-green discharge from your penis. You might have burning or pain when you urinate. You might urinate more frequently, and you might have swollen or tender testicles. Women, you might have a gray discharge from your vagina. You might have burning or pain when you urinate. You might urinate more frequently. You might have bleeding in between periods or heavier periods, okay? If we do not get tested and treated for gonorrhea, we can have long-term health effects, okay? It can cause men and women not to have children. Women can cause women to have pelvic inflammatory disease, which can be sometimes deadly, okay? It can also cause moms to pass it to their babies during childbirth. That baby can be born with an eye infection or pneumonia. It can also mean that we might have heart issues, arthritic problems in our bones, and we might have a skin rash. Now again, this one is treated by an antibiotic pill and an antibiotic shot. Follow the instructions the doctor prescribes to you to make sure you take it all correctly, okay? We also test this for the same way we test chlamydia, a urine test. But again, other types of sex you're engaging in, talk to your doctor so we can do a swab of your throat or your anus, because a urine test is not going to pick that up. As well, if you're having symptoms, we can swab for those symptoms as well, okay? That is all for gonorrhea, okay? Next is syphilis, okay? Syphilis is spread, like we talked about, through different types of sex that we engage in. The only thing that's different is there might be a sore sometimes with syphilis, okay? Now, this sore, we can also get an STD through genital rubbing. So it's really careful to be really careful that we're looking at our genitals, okay? To make sure we don't have a sore. And if we have a sore, we don't want to engage in genital rubbing, and we want to always always use a condom no matter what type of sex we're engaging in, okay? And a dental dam for women if it's an oral sex, okay? So if I have syphilis, again, most men and women don't have signs or symptoms. Again, you might have symptoms and they might be a sore. That sore is going to appear anywhere we had sex, okay? That sore is going to eventually go away and heal, okay? But just because I got rid of the sore doesn't mean I got rid of syphilis. The next set of symptoms might become a rash. That rash might appear on your torso, your palms of your hands, the soles of your feet. That rash might be accompanied with flu-like symptoms, okay? Now remember, syphilis is curable. We'll cure it with antibiotic shots depending on how long you've had syphilis for. The doctor will look and either give you 1 or 3 shots, okay? Antibiotic shots. We would also test you through a blood test, okay? And this is a fast test. Most places are able to tell you if you have it in 30 minutes or not, okay? If we do not get tested or treated for syphilis, it can spread to other parts of our body, our brain, our heart, our spinal cord, okay? It can cause us to be mentally ill, blind, paralyzed, or kill us, okay? Moms can pass it to their baby during childbirth. That baby might be, and it also might happen, that baby might be stillborn, which means the baby is dead when she gives birth, or the baby mom might miscarriage, which means the baby dies during her pregnancy, okay? So that's all for these STDs, their signs and symptoms. Now remember, if you had unprotected sex last night, that STD test is not going to show up tomorrow, okay? With chlamydia and gonorrhea, we want to wait about 3 weeks. With syphilis, we want to wait about 3 months, okay? Remember, we always want to wait 7 to 10 days after we have taken the whole dose of the medicine, okay? Wait 7 to 10 days after we engage in having sex with our partner. We also want to do initial follow-up testing to make sure everything is okay. Always use a condom through any type of sex we're having, okay? So if you're performing oral sex on a male, use a condom. If you're performing oral sex on a female, use a dental dam. If you're having vaginal sex, use a condom. If you're having anal sex, use a condom. These are going to help prevent these STDs, okay? That's all the time we have for today. Make sure you're always getting your routine STD tests. If you want to make an STD test at the health department, give us a call. Otherwise, you can go to your local doctor's office, Planned Parenthood, primary health care, or anywhere that else tests for STDs. Make sure to sign up for an STD test today. Thank you.